The GUAM Memorial Hospital is facing scrutiny for refusing to give up the Joint Commission inspection report that details areas of failures leading up to a decision to deny accreditation pending appeal. At an oversight hearing last night, lawmakers scolded GMH administrators, pointing out that legislative help is contingent upon knowledge of this report. It's the first time since 2010, when GMH obtained Joint Commission accreditation after decades without it, that the hospital administration received word that they are being denied accreditation pending appeal. They've had many close calls over the last few years, but not as close as this most recent survey. At an oversight hearing last night on GMH's finances, hospital administrators implored lawmakers to assist them and take action to end the decades-long financial crisis. But when lawmakers attempted to glean information from the Joint Commission report detailing their deficiencies, GMH clammed up.
And so are we going to be able to see it, and what is the timeline?
The report is, as advised by our legal counsel, is not releasable.
Healthcare Oversight Chairman Senator Dennis Rodriguez.
It's kind of strange that that is not releasable, especially to us here, where we're here really to provide help. It's not going to be productive in our discussions even for this evening, because not knowing where you're coming from in terms of this specific issue with the report.
It is very difficult to run a hospital without adequate finances.
Yes, and I think it's also very difficult for us to find out how better we can help the hospital. The legal aspect is we can't see the accreditation results.
Well, there's certain things that you can't see in the hospital. There's a lot of protected information.
Well, the HIPAA maybe,
but we can share that, you know, when you have an average operating loss of $30 million, that's definitely going to impact patient care.
Speaker BJ Cruz joined in on the skepticism.
I'm a little disturbed by the "we cannot release it." If I was to tell that to the two white coats at the end of your table there and tell them I don't want to tell you, how are they going to be able to provide any diagnosis and treatment for me if I'm unwilling to tell them where my pain is? Guess. We have to come forward and say that the pain is wherever it's at. Well, I'm embarrassed to say where it's at, Doc.
Vice Speaker Therese Terlahi also referenced a PNC article to demonstrate that GMH has been sending mixed messages about the kind of help they need. The article was published in September last year, in which GMH's medical chief of staff sounded off on a recent survey by the Centers for Medicare and Medicaid Services, warning that GMH is on the brink of losing accreditation. In our story, the Vice Speaker points out that GMH CEO Peter John Camacho responded to our inquiry and talked about some of the areas of concern cited in the CMS report.
It does seem very strange to me that whether we could talk about the issues for accreditation that we're looking at one day versus the next day, that rule changes. I don't understand that at all.
GMH CEO Peter John Camacho agreed to provide the Healthcare Committee with a letter from their legal counsel stating why they are unable to release the report to the public. Also, on News Talk K57 this morning, Camacho revealed understaffing as one of the concerns in the Joint Commission report, which is affecting the availability of beds in both the ICU and telemetry wards. He says understaffing is cause for alarm since the report cited a case where medications for a patient were not listed in the patient's chart, an oversight brought on by fatigued staff.